Dobrodošli u podcast o zdravlju i ljepoti. Danas smo u segmentu zdravlja. And yet again with me, Dr. Peter Lohuis. Today we're going to talk about revision rhinoplasty. So, what is revision rhinoplasty for all our viewers?
Revision rhinoplasty is a rhinoplasty where it was done before, either by yourself, then I would call it a touch-up, or by another surgeon, and then it can be a touch-up, or it can be a completely new surgery, usually because patients are not happy with the result or the function.
And would you say it is the most common surgery that you find here in maybe clinic?
No, because usually it goes well, I think. In the beginning it was because we were new here, and then there's a certain group of people around that say, all right, there's somebody new in town, and we saw a lot of revisions in the beginning, whereas we see now more and more primary rhinoplasty.
And can I ask you about the challenges for the surgeon in this area?
It's completely different because the tissue is different. You don't know what to expect. You have to go as you find, you go along. And the scarification processes have taken over. It's difficult surgery. Also, in any case, actually. Yes.
And when do we have this revision rhinoplasty?
When the patient is not happy, functionally or aesthetically, and it is possible to make improvement, because that's not always possible. And then you decide for a revision rhinoplasty if patient agrees with the risks, etc., that it brings, because also it can, after revision surgery, can get worse than it was before. So you have to kind of balance and weigh your risks against the effort.
And revision rhinoplasty is much more complicated than the primary one.
Yes. Because there's scarification, tissue is different, it can be bended, you cannot get it straight. You need usually cartilage to make something. You don't know if there's a reservoir, sometimes you have to get it from the ear or a rib somewhere else. And the predictability of the surgery is less. So, like I said, you find something, and then you have to go with all the techniques that you have in your armamentarium and pick something out which works on that particular moment. So also for the surgeon, it's less predictable what he's going to do. Sometimes you don't know what to do. You just go along as you find something.
It's like a cat in the bag. You never know what to expect.
Well, sometimes you do, but sometimes in the really difficult cases, you really don't know what to expect. So you kind of improvise as you go.
So what is the most common complaint that people come to you for revision rhinoplasty?
Function and aesthetics, so they're not completely
more
happy.
More function or more aesthetics?
Both.
Both.
So aesthetic is harder to please, you know, what is beautiful. They have an idea that they think it can be better, and maybe that's not possible. That's one. Functionally, sometimes they expected better breathing. But usually is that they're not happy enough. That's the reason that they come for revision rhinoplasty.
How do you talk to the patients that are not happy enough? I imagine it's hard.
Yeah, it's realistic expectations, and if you think it's possible, you really explain to them what you think is possible and what is the chance that it works. Sometimes I just say, all right, I also don't really know, but I think I can get it better, but I don't know how much better. You have to jump in the pool, or you don't jump in the pool. It just depends on how you feel with your nose at this moment. But you know, when I think it's not possible, or when we think it's not possible, then we don't do it, because we also want happy patients. Which not means that we always can get what we want, but that should be the first step, that you kind of think that you're going to make somebody happier aesthetically or functionally.
And you have great experience in that field, so you should really know.
Yes, because I think 30-40% of what we do is revisions.
And what are the possible complications?
Complications are like any other rhinoplasty, after bleeding, which is rare, maybe infection, which is rare, that some structures dissolve under the tension, it's possible, or again, that they are not happy with the result. That's also, in a way, a complication, as I see it.
Percentage-wise?
Usually they kind of understand that it's not possible to go any further, because it can also get worse when you open it again. So most people are kind of realistic. And what is good enough? You know, not everybody can have a 10 plus. Somewhere between 8 and 10, it has to be okay.
And how many revisions can one have?
Depends on what was done and how bad the skin was. Skin is usually the determining thing. Sometimes when you open it, it's really scarred. It's really hard to open, and then I make a note, say, all right, don't open it again or something. For myself, this was the limit, and then you have to kind of bring that across. It's different psychology, different talking to the patient, different surgery.
And how to avoid the unwanted results?
Good training. Don't go too far. Try to keep it natural. Experience. Yes.
Experience.
Statistics. It's statistics. Yes, it's statistics too.
And in Croatia, what do you say? How are the patients in Croatia?
They're good patients, nice patients, realistic. I think it's the same mix as in the Netherlands. It's a little bit different features, but it's the same patient behind it, same psychology. They're kind of realistic.
And what is the aesthetics? Do they want more rounder, smaller noses, or?
They all want a nose which is breathing well, which is usually smaller, which disappears in the face. So usually they have kind of a nose which is very visible, and as soon as you can make it disappear in the face, then eyes, lips, other features become more visible. That's the whole idea. A good nose disappears in the face.
So that was my next question, how to make it more natural. Because I know that you like more natural.
The natural thing is that people like average faces, you know, and then they have certain features that they make very eccentric, like your eyes and lips, for example, and then it becomes very beautiful. So it's average plus a high feature, you call it. And with the nose, it's the other way around. You try to make it as average as possible, because the other brain interprets that as normal, and they don't see it. That's what people like. They don't want to see, all right, he's looking or she's looking at my nose, and the nose is not there. And that's sometimes also the psychology. They say, all right, now I'm not worried that they are looking to the side of my face anymore. That kind of stuff.
And for you, what is a beautiful nose?
Well, I have a feeling what I think is a beautiful nose on a certain face. So what I do is I think what is there on the inside when I see a patient. I think what I like, and then I try to recreate that anatomy, that it heals to something which I thought that was going to be nicest. Right, when that works out, then you have happy patient, happy surgeon.
And how is it to explain to the patient this? Because what you were saying, it's a bit of art.
You can make it with imaging. We have an imaging system here. You can kind of try, but you know, it's not always honest because it looks so smooth. Realistically, it's sometimes harder to make it. But then you have at least a way of talking to each other. And sometimes they just trust it and say, all right, I saw your results, just go for it. And do you understand that we want to do this and this and this? You say, okay. And then they just jump in the pool. Because in the end, it's all trust. You have to jump in the pool and see if he can do what he promised to do. That's why I like to under-promise and
over-deliver.
Over-deliver, yes. Yes.
So thank you very much. Do you have any messages for the future patients? Why should they come to you?
No, when they have to come to me, no, there are a lot of good surgeons. Find somebody you feel comfortable with, and then choose if you want to do it, if it's a problem for you.
Thank you very much. Evo, kao što vidite, ipak se informirajte, popričajte sa svojim liječnikom i odlučite se za onog najboljeg, a mi se vidimo u našem sljedećem podcastu.